Hi, Sasha. Hi, Gertrude. Hi, Erica. Guys, let's say hello. Just drop, or you can say hello. I would love to see people's faces, and drop in the chat box where you're from. Um, Tell us where you're from, Sasha.
I'm in New York City.
Okay, sweet. Hey, America. Hey, guys. So can you drop in the chat, or just share like where you are and what you're hoping to get out of this live Zoom? And we're just going to ask until we have 1 or 2 more minutes till we'll start. And then I'm going to dive into the content. Hey, Gertrude. Yeah. So tell us where you're from and what you want to get out of today. You want to start, Sasha?
I don't know if I have like a specific one to get. I think I'm just like in a curious space. I think I'm doing an EMDR like intensive right now. So obviously like trauma is like kind of the core of that, like targets. And I think I'm also just zooming out more. I mean, I've always considered myself a trauma therapist. I think most of us should consider ourselves trauma therapists, but just to kind of like not just generally have an understanding, but also other effective modalities. Even though I think EMDR is fantastic, I don't think it's a one size fits all for obvious reasons. It's a lot more somatic and people have to
Yeah.
be really like ready for it. So I think for a lot of folks I work with, it's just like they're not there yet. And I want to
Yeah.
think about other ways to kind of, just be very person-centered, since I think that's
Yeah.
the core of trauma work.
I love that. Yeah, it is. So many of I'm actually writing a book with New Harbinger on EMDR, and I wanted to call it EMDR for rebels, but like it's a little too provocative. But I'm like, no, it is. Like I'm all for EMDR, but I blend it with like somatic and IFS parts work. A lot of the training that I've created, um, and that I support therapists in is having like an integrative approach. So do any of you want to share where you're from and what you want to get out of this? Because we're gonna dive in just a minute. So I see all these faces here. Okay. How about you, Audrey? Do you want to share?
I don't know. What am I supposed to share? I'm EMDR therapist. I'm a DBT therapist as well. And I don't know. There's so many different trainings out there now. There's somebody's on me to go do ART training, and it's just
Mhm.
like, how many trainings do I need? You know what I mean? Like it's just like I've been doing this a long time. It's like 20 years I've been doing therapy. So it's like um I don't know. I just want to be able to give my clients the best I can, and meet their needs where they're at. And there's just so much out there. So I'm looking for a really good funnel
Okay. Right. You're saying like to
for
be able
sieve, really.
to sift, to sift.
Yeah. It's like sift through all of it. Like, okay, what do we need?
Okay. So I'm going to dive in. There is going to be a point where I ask you guys, for anyone who wants to know, like it's definitely being recorded. I'm from home because my clinicians are all in the office. I run a group practice. But very briefly, this is about being the empowered therapist. So I labeled it from good to great. And essentially, my goal of this 1 hour, 50-minute masterclass is really to help you solidify the knowledge that you already have, maybe learn a tool or two, and really get clearer on like what are the next steps that you can take for yourself and for your client. Now, it might mean like just re-owning what you already have on a deeper level. It might mean like shifting shifting the work that you're doing, and it might mean something else, but I want you to be able to walk away. I want to be like kind of that person in your corner who really supports your work. Just briefly about myself, I'll do a basic intro. For anyone who's joining right now, I invite you to write your name and where you're located. Okay, curious to learn more about. Okay, where you're located and your name. Okay, and your training. So very briefly, my name is Esther Goldstein. I started out working as a therapist who specialized in addiction, and then over the years of working with like clients who were navigating addiction, I looked at the difference between people who held sobriety to people who kept relapsing. And I couldn't understand it. And so I was like, I'm not staying in the field if people just keep feeling like a failure or ashamed of their behaviors or their coping mechanisms. Actually, just in our team meeting, I run group practice. We have therapists, we have a psychodrama therapist, art therapist, just a bunch of different therapists where we support each other and we provide counseling. We were talking about addiction and how essentially addiction or any kind of coping is really just a form to cope with pain, right? It's creative. So anyway, I ended up looking into post-grad trainings and I was like, I got to get to the core of why some people keep using certain behaviors versus other people. And a lot of it landed up in trauma. Now, before I go into trauma, and I'm going to go into this in a minute, I just want to share that my approach to being a therapist as a human and also training therapists is very humane. And let's look at all forms as coping is really a desperate need to survive. Now, at the very same time, we want to be looking at like, how do we help our clients link up their coping mechanisms with understanding what their survival strategy is. For some people, they're stuck in fight or flight. Some people are stuck in, submit or collapse. And then we also want to be providing aligned treatment that helps us feel clear and our clients feel clear, because there's always a parallel process. If I'm feeling murky or overwhelmed, my client's going to feel murky or overwhelmed. If I'm feeling clear, maybe there's complex symptoms or maybe there's complex presentation, but I know your primary issues. I know your childhood issues. I know what you need to actually start feeling relief. There's going to be a much clearer sense of direction for the client, so they feel more held and you feel more confident in your work. So I just want to talk about the things we are going to be speaking about today. One is we're going to look at your core struggle. I'm going to ask you to take a moment. If you don't have a pen and paper now, I invite you to take a pen and paper. It's just a self-reflection exercise I want you to do for yourself. So we're going to identify your core struggle, because the clearer you get for your own self, who you are as a person, like there's a reason you're in this field. Almost all of us come here because we have a very, very big heart and because we have a passion to be aligned with who we are as people and as professionals. And so I want you to look at, we're going to look in a minute at your strength and your struggle. Even just becoming aware of that can help you shift internally. Then the next thing is we're going to look at the concept of looking at difficult cases, a viewpoint of difficult cases. I talked to you about, for some cases, what's helpful for us to look at is what kind of session is this? Is this a boundary session? Is this an attachment session? Is this a shock trauma session? Or is this a developmental trauma session? We talk about that a bit more because knowing what kind of treatment or what kind of therapeutic intervention your client needs is very important. If you're going to the deep dive for childhood trauma, when essentially your client needs to learn the basics of boundaries, either physically or energetically, you're not going to help them. And then the whole therapy is going to be lopsided. So we'll talk about that. Then we'll talk about some tools for transformation. There's some trauma-informed tools that I find helpful. I'll show some of you guys one or two tools from the trauma course. I created a 6-month trauma training that really combines my 3-year sensory motor training. I got trained in 3 years of sensory motor psychotherapy. I'm an EMDR consultant where I support therapists who are trained in EMDR, and I'm trained in parts work. So I like using like a blend of, I needed this training 10 years ago. And then we'll look at like next steps.
Why?
Okay. So what I'm going to ask you to do for just a moment is to take your pen and paper and write down in the middle of your page. If you've been here before, then you might have done this. Write down in the middle of your page your name. Just write it down. Okay, and once you write down your name, I want you to just look at your name, and then I want you to just take a deep breath.
Oh, Stephanie.
And then on the right-hand side, I want you to write what you want more of in your personal and professional life. And then on the left-hand side of your name, I want you to write what you want less of in your life. It could be less of a feeling. It could be less of something. Okay. And when you're ready, or when you've done that, I would love to hear anyone who's comfortable sharing what they noticed that they wrote down. Sasha, do you want to share?
Sure. Mine were like directly opposite. So what I want more of is more confidence, and what I want less of is self-doubt.
Okay. So I love that. So what does confidence feel like in your body?
When I feel confident,
Yeah.
I don't know, like an energy, kind of like yeah, I would say it's like an energy.
What allows you to feel confident? Like, what are the factors? Like, for me, it's clarity and it's knowledge. What is it like for you? I'm curious. What allows you to feel confident?
I think past experiences, like I'm thinking about in work specifically, but like
Mm.
when I remember something I've done well, I can like bring that back currently and utilize that to do the thing again or do something similar.
Yeah. Yeah. It's almost like I can replicate this. Like, I've done this already. I have the confidence, like I can do this again. Yeah. And about the self-doubt, was that connected to the same thing, like just being able to navigate?
Mm-hmm.
Okay.
Yeah. So quite the opposite when I feel like I haven't done something or I'm questioning if I have the knowledge, like you said, or the experience. If I haven't done it before, then I'm like, what makes me think I can do it now?
Right. Right. Yeah. And it's so tricky because I want to check in on anyone else. But it's so tricky because the only way to learn is to try something new, but we always take that step with a little bit of hesitation, right? We can have a level of confidence in something brand new. We can have a level of curiosity. And then the next time we take that step again, there will be that confidence or that learning, right? Or that humility. Thank you so much for sharing. Who's up next? Who else wants to share? Anika, do you want to share what you want more of, what you want less of?
I'm not sure if you're pointing to me or somebody else.
You, I'm looking at you. Yeah.
Yeah, so I'm Ankita. I'm in India. Hi, everybody. Um, I mean, as therapists, I think that's the first thing that comes to our brain, right? We want to be more effective as therapists. So that's there in my more of list because I want to be more structured in my casework approach because I think that's where, like Sasha was saying, that as a therapist, you crave confidence.
Mhm.
And the more hold you have over your case, you're just a different person, I've realized in the session. And the more you have been struggling inside, or you feel, hey, I really don't have the crack at this case, the next session, even I am super uneasy
Mhm.
going into that case. So I think I realized that it's not just about, like Audrey was saying, just learning more and more and more and more modalities. I used to be that person a year ago. When I did a lot of self work, I realized I think it's not just learning a lot of modalities, it's how you apply whatever tools you have. So now I'm trying to be more structured in my approach and understand my cases better, understand their needs better. So that's what I want more of. And I think less of worry that I won't be able to figure out my case because everybody's different. So once I just emotionally and mentally be present in my cases, I'm able to sort it out. And I do see that success. So I think I want less of self-doubt and
Mhm.
worry on, oh, this will be tough and I won't be able to figure it out. And more of probably more structure that will give me more ease to get into the cases. And then there's the personal stuff that I've written.
Yeah. Okay. I love that you're sharing this piece because it's almost like to me, I almost look at it in terms of like an attachment lens, where it's almost like as we're developing relationships with our clients, we're also developing a deeper relationship with ourselves. It's like I want to develop a secure attachment to my therapist self. And secure attachment is when my therapist self and myself say, hey, we're both learning. There's a lot going on. I want to figure out what I can do together. The only way to deepen a relationship is to consistently show up, right? To show up and to say, I don't have it all figured out, but we're going to figure it out together. And to also get good guidance, to just be like, I know for myself, there was a time where I was like almost on this like run of gathering more and more training, but I came across a little bit disorganized in my session. And the reason was because I wasn't digesting it in my own self. It was coming from a place of inadequacy versus like, one second, I have information. Now I need to know how to apply it. It's almost like people who get into relationships and they love the relationship high, but then when they get into a longer term relationship, there's almost this boredom. But really, if you could settle in and you get curious about all the pieces that play, you're going to deepen that relationship. So A, for yourself with your therapist self, and then B, with your clients, really saying, okay, we're deepening into this work. Now there's a feeling of intentionality, or this is what we're going to work on. Can we go here? Right? Because the client needs to hear, like we just had this in our team meeting. we were talking all about understanding addiction. And then I said, okay, guys, now we spoke all about the understanding it, the function, the parts, how we talk to the part. And I said, now I want to talk to you how you actually work with that pain point, right? Because the client needs to hear your confidence, where you basically say then, hey, Deborah, so I noticed that there's this part of you that doesn't eat when you're feeling out of control. And then we do something called in parts work, we talk about direct access, where I said, if your client is very blended, because some of our clients are very blended with the part that's having a hard time coping, and some are not very blended with the coping. They might say, I'm struggling with something versus I am the struggle. I am anxiety. I am panic, right? So you have to discern, are they blended with that part? And if so, then you work directly with that part, and you, from a confident place, say, okay, but I'm feeling confident, or right, Deborah, I want to talk to this part of you. I can help you. I know I can help you. This is what it's going to look like. Right. So there's also like not just talking about the problem or to the problem. It's also like, these are the steps we're going to take. And then you even take one specific step or an intervention of working with that symptom. So I think that's a big piece. Right. And you're talking about that deepening. And I think as we do that, there's less worry in being able to do that. Thank you for sharing, Anika. Any one last person? Kalaniki, do you want to share? I think you're here. See if there's anyone else who wants to share what they want more of or less of. Okay, I'm just going to keep going into the information. Essentially, what I do want to say, Anika, Nikita, is that a lot of what I created was structure, because what I found was that like therapy a lot of times is meant to be organic and creative, and at the same time there does need to be a sense of structure. That's why we have science-based interventions. And so what you'll see here is where I provide some elements of structure to help you be able to orient, what is it that's going on, what's my client's pain point, and how am I guiding them there. And even if it's a little wobbly along the way, I have a format that I can follow. So I wrote here, right, you aren't alone. The path to greatness is closer than you think. You know, I created this specific trauma training, and even just like the masterclass, to create a roadmap. You know, I created, I think I shared this many times, but I started off as an individual therapist, and I was literally traveling. I'm a mom. I would go through traffic to try to, you know, get expert consultation, reach out to lots of different peer groups. I felt kind of isolated and alone. And I was like, what's the format? So I have the somatic training, I have the parts training. Where do I go from here? And I do also have a blog that I've written. Our website has anywhere between like 75 to 80,000 hits a month. And it's less, I'm not sharing this to brag, I'm more sharing because I put information out there really with the world and normalizing clients' pain points and normalizing the process of healing. It's not just about making a person stop using a substance or a person stop having anxiety, or, you know, to tell people they're bad at relationships, but really just giving a human relational voice to ourselves, to our struggles. You know, I would Google things at night and I didn't find anything online, and it took me time to find a good therapist. And I have, and then I've connected with therapists around the world. So I'm really here to support you and thanking you for raising awareness, because a lot of trauma healing, right? Trauma healing makes the world a better place, because it's the way we understand our brains. It's how we communicate it with our clients. Then it's how we communicate it with our, you know, our loved ones. And it's creating, you know, a more global impact about the way we speak about trauma. So many people talk about, you know, that they feel a lot more hopeful. The difference between people who feel, you know, hopeful about healing to not feeling hopeful about healing is there a way through? And if there's no roadmap or no way through, then I'm going to have a really hard time. Right. And if there is a way through, right, if there was just the scientific research on people who feel very suicidal to people who don't feel very suicidal. And so the difference is all a matter of hope. And hope, I'm not talking about as like this fluffy concept of one day you're going to feel like you can actually survive this thing called life. Hope that's anchored in reality and in scientific data is the difference between somebody wanting to wake up the next morning or show up to their life or actually move through processing or show up to therapy, to the ones who say, you know what, that's it, I'm giving up. Right. And so we're here to provide hope that's anchored in scientific data and also in our experiences of what actually has been effective. I do want to share, I'm going to be going through difficult cases. I know some people were asking about trauma-informed information. So I'm going to be pulling up a case of someone called Charlie. Now, I want to show you from Charlie, right? He was a specific client where I've spoken about him a few times. He was a client that presented with a level of anger. He was very together on the outside, but presented with a level of anger. He presented with a level of like disconnect, like he didn't want to have a level of connection with me. He just said he needs to come here because his wife said that he's not emotionally present. But he also had somatic symptoms of back pain, which he checked in with the doctor, and although medical practitioners said he was fine, but they couldn't get to the core of what it was. And in our work together, and I'm going to pull up the modules for my trauma training in just a second so you can see where we dove in. But from my work together with him, in getting to know him, I was listening in for what's the pain point that he's holding beneath the surface. Because if he was so externally successful, or as he put it, it didn't make sense to me that he was struggling as much as he was struggling. So I was like, either he is okay and his wife is, has some emotional unmet need, or there's something going on in the dynamic. Now, what was going on was that he had this inner child part of him. You see this like little boy over here? He had this part of him that was really struggling. What happened is that his wife wanted emotional connection and wanted a level of emotional intimacy. And anytime she wanted to reach for connection, what happened is that he would run away. And as we did some work in therapy, which I just got to know him, I was curious to get to know him, I realized that this little boy, Charlie, never had emotional boundaries. His mom and people in the family would just dump their emotions all onto him, and he never had a sense of self separate from the people in his life. And so there was a threat to his wife needing connection. He felt like he would lose himself. And so part of the work was a boundary session, which I'll pull up in a minute, was really helping to come up with helping Charlie realize that he has a sense of self separate from his wife. And somebody else can share something with you without you becoming enmeshed, without having permeable boundaries. But it took time because I had to listen into like what was going on and what was the danger cue that he was hearing when his wife started sharing about emotions, right? I couldn't just tell him, hey, you have an inner child inside of you. So I just want to show you, I'm going to pull up in just a moment the modules that we go through in our trauma training. But just very briefly, I want you to be thinking about with clients, right? With our clients, often there's a theme either of boundaries. And boundaries essentially means that we're creating boundaries in the therapy room. We'll either create boundaries, physical boundaries. There might be somatic exercises that we use to create. But they need to first know what the boundaries are in terms of what's your therapeutic relationship with them. How often can they speak with you? What's your session time? Right? There's the structure of the therapy that you're creating boundaries. And then we're helping them orient to the boundaries in their lives. Now, I'm just going to stop sharing the screen for just a second because I want to show you from our module, here we go, from our trauma training, when it comes to the modules on boundaries, what this looks like in real time, okay? So in each of our modules, just so you see, can you guys see? Hold on, let me just see for a second. I'm going to share my screen.
Not yet.
Can you see my screen? Can you still see my screen?
No, we can't. We can only see you.
Okay, can you see my screen now?
Yeah.
Okay, amazing. So I'm just going to show you just the format first for a moment of the course curriculum, and then I'm going to pull up the boundary exercise because I've shared this with people. Actually, if you're interested in our free, we have a download boundary exercise that a lot of people ask for. If you're interested after this, then I'll shoot you an email for those people who have been in the recording. You could get a copy. But very briefly, from our trauma cohort, you'll see we have different modules. So there's some that are more psychoeducation where you get to see like images of the brain and the body, and it helps our clients understand what's going on. And then in the modules, okay, then each of the modules has different goals, right? There's module 1, which is the making of a trauma therapist. Module 2 talks about, the research of trauma. Now I'm going to be pulling up the boundaries exercise one because I want you to see how we engaged in boundaries exercise with Charlie. Trauma in the body. I'm going to pull this up for you. Okay, so here we go. So the boundaries exercise, okay. So what happened was, I'm just going to first show you a video on the body posture. The way that I got to understand that he needed to work on boundaries was that I noticed in his body posture, something shifted whenever he spoke about his wife's desire for connection. So I'm just going to show you briefly a video of, the back end. Sometimes they want to make sure you can get all the information of this training. Okay. So in this training, what I show you is how to read the language of your client's body, and based on what you're reading, how to actually work. I'll take off the volume. And it basically talks about how to understand what's going on somatically and what's happening inside of them. So here, let me pull up some of the images. Okay, right here. Here's a client who you might work with differently than creating boundaries. Here's a client that almost has the submissive stance, is almost looking up and is trying to, have a position, have a presence in a relationship or with someone in their life, right? Now, there's also clients where they're constantly on defense, right? They're almost needing to defend themselves. So what you'll see here is I created this image of when you think about your clients, here's a certain body posture. This is, by the way, in the trauma therapist toolkit, the free download. Here's a client who's hunched over. Here's a client who's leaning forward. Here's a client who's pushing out their chest, right? They almost need to like overexert a sense of control. This person might be constantly on defense, getting into arguments. This person looks like they're toppling over. This one's more of a collapse. What we want to look for is someone like this. And this might sound really funny, but essentially with good trauma-informed therapy, or being able to engage in good relational work, I look at their body posture, right, to see if like we're doing good work. Because with Charlie, what happened is that when he came in and he would talk about his wife, he had this posture, almost like pushing it, almost needing to defend himself. And part of the reason he was doing that was because he felt like he would be threatened to lose himself if he wasn't overly pushing her away, overly pushing and speaking up his needs. And what we wanted to work on, and I'll show you in a minute, the boundary exercise we did, was for him to actually be able to feel more secure, having a more gentle way of being present, feeling more steady inside. And should there be emotional needs that she has, not feeling like he has to overtake those needs, but also not feeling like he needs to, push her away or, shut down, which is what was happening. So let me just talk to you a little bit first about what Pad Ogden talks about. She's the founder of Sensory Motor Psychotherapy. She says that psychological capacities and beliefs are inextricably linked with the structure and the movement of the body. So when your client comes in, a lot of what we talk about in our trauma training is, when you're thinking about a client session, is it going to be a boundary session? Is it going to be an attachment session? Okay. A lot of what you're going to be looking at is what's their somatic presentation in the therapy room? And also what's their body language telling other people in their life? Now, you're not telling them, oh, you're walking around all collapsed or oh, you're walking around defensive, but you're taking that as information about how they're walking around the world. Because what we want to do is help them to feel more secure in their minds and bodies. Now, coming back to the client, Charlie, I'm going to show you an exercise. Okay, so here's a somatic boundary exercise, okay? In our boundaries module, there are exercises that I go through and I explain for you to actually read, for anyone who's taking the training to read, to understand the concept of boundaries, how boundaries protect the inner core of your identity and your right to choices. And so with a lot of our clients, even just orienting to the concept of like, there is nothing wrong with setting boundaries. You're not going to lose yourself. You're not going to lose relationships that are healthy. Obviously, we want to help them set boundaries that are healthy and helpful, but we want to help them orient to the concept of boundaries. Here we teach all about the biology of boundaries. And then there's exercises that we teach them to engage in, okay? And just briefly, Dr. Herman, Judy Herman, talks about unable to care or protect herself. She must compensate for the failure of adult care and protection with only means at her disposal, an immature system of psychological defenses. So here, Judy Herman is talking about how people have defense mechanisms that are not ideal. Either people push people away, or they just shut down on people please, or make other people feel happy. And they don't set boundaries because essentially they get very scared about what it would be if they set boundaries. So what we'll see is we'll have people who have secure boundaries, we'll have rigid boundaries, or we'll have permeable boundaries. Okay, now I'm going to show you the somatic boundary exercise that is in our training, and then I'm happy to share for any of you who want the boundary download and the video. Essentially what I did with Charlie is that we tried this 3-section boundary exercise, okay? There's 3 elements to it. And you'll see the first element is where I walk towards a client and I tell them, I walk towards Charlie, and I asked Charlie to just notice what it was like in his body as I walked towards him. And when he felt like he wanted me to stop, to just put up his hands. Okay, just to start orienting to this feeling in his body of when it felt comfortable for him to say, here's where it's good to stop. The next time I did it, I said to him, as I walk towards you, I want you to notice what it feels like in your body. And I want you to say the word stop when it feels right for me to stop. And then the third time, so we're kind of reinforcing this somatic experience of the body engaging this activity. I want you to do both, like put your hand up and say the word stop when it feels like it's the right time for me to stop. Now, I just want to give you a backdrop. Obviously, not all clients are appropriate to do this exercise. This is a high functioning client. Some clients, even just you telling them that you want to try something, try an exercise, and ask them what it feels like. You need to let them know that you're not insulted. If they say to stop to you, it's just information for them to actually orient to getting in touch with what feels right, what feels too close, or what feels too far. There are clients, it didn't happen with Charlie, that don't say stop. I had a client who really just never had love and nourishment and almost like is comfortable with enmeshment because that's what makes her feel secure. And at a certain point, I started walking towards her and she never said stop. And I said, okay, I'm going to stop here because this is what feels comfortable for me. And so for some clients, the work is actually helping them understand the difference between self and other. That wasn't the case with Charlie, but I'm just going to show you briefly the exercise I did with him so you can actually get to see the exercise that I did. So here I go into explaining the 3 steps of the exercise that I did, okay? So I explain it in detail, and here I explain it. Here we go.
I tell the client, I'm going to start walking, okay? When you feel like I'm getting too close or it's not comfortable, you're going to say stop. And just notice what happens in your mind and your body before you say stop, or when you say stop, and how I listen to that request, okay? So here I am. I'm walking far away. I take a few steps away from the client, and I just say I'm going to walk really slowly, okay? So I'm walking really slowly, and I just start walking towards it. So
now, what I want the client to track is not just the fact that I am walking towards them, but to listen, to notice how I listen to them as soon as they say stop, or as soon as they engage in a behavior that they're letting me know that they don't want me to come any closer. And that's really important because they're also tracking to the fact that they can say something and what they're saying can be heard. Okay. Now, this information, Charlie didn't go home and suddenly tell his wife, I don't want to listen to you. What started shifting for Charlie was that he started noticing that he has the right to be able to orient to what feels right and what feels wrong. He started setting energetic and emotional boundaries with his mom. He didn't need so much to shift the boundaries with his wife, but he needed more to be able to honor what was right for him, to be able to tell his wife, hey, honey, I can listen to you for 10 minutes. And after 10 minutes, I'm going to be going for a run. Just starting to be able to make sure that he could carve out a space for his own self, separate from the conversation, because he would lose himself. And it was less a matter of her needing attention. It was more about he didn't know how to set boundaries in a relationship. And so as he learned to be able to take better care of himself, he was able to be more present in the relationship for and with her. Okay. There's one other exercise that we explain in this video where essentially there's exercises where clients push against the wall, push against pillows. There's a lot of exercise we teach you here that I'm not going to go into. Now, there is also, I'm going to stop sharing for just a minute. There's also an important understanding of knowing, how and when to offer certain interventions for different clients. So essentially, let me just pull back up the screen of the Empowered Therapist. So essentially, what's also really important to be able, hold on one second, to be able, here we go, the slideshow. Just make sure I'm sharing with you guys the right slide. There we go. Okay. What's really important is also to know how to be able to know like what's going on, right? If I went into Charlie's session and I basically said to him, hey, let's do some attachment work. And I'll show you soon some of the videos on attachment. Attachment work is very different in the sense that we want to look at, does your client have more of a anxious attachment personality style? Does your client engage in a disorganized attachment? What's their attachment cry? Attachment is basically a relational dynamic that they interact with. If I thought that Charlie needed a sense of security with me and I leaned on us developing a therapeutic relationship as the primary, we did need to develop a relationship. But the way that I developed a relationship with him was first helping him orient to the fact that in this therapy room, This is what you do. This is my job role. I went over the services agreement. He needed to understand clearly. He didn't have to take care of my feelings. That helped him feel clear. And then I said, I want us to work with a part of you that starts shutting down when your wife reaches for connection. Right away, he needed to see that I could actually be helpful to him because he was smart, he was successful. His children, part of what also was going on is that his children started feeling a little bit disconnected, not wanting to spend time with daddy. And he didn't understand why, because he would spend time with them, but he wasn't emotionally present. No one was home. Because what happened was his inner world, his inner parts were running away because he got very frightened from connection. He felt like he was stifled. So if I, thought that I'm treating like a shock trauma of something that happened years ago, or if I would start working on the neglect of his mom, not having boundaries with him as a child and starting to develop that, going into his childhood experiences in that kind of way, I would have lost him. He would have been spiraling into with symptoms for a while. I knew that he needed boundaries because as I listened to him, I noticed that his body would start feeling very defensive and then he would kind of pull away. And so as I gathered that information from therapeutically working with him, which is why it's so important to know what's going on, let's assess what's going on. I was able to then look at, okay, what's my goal for this guy? How am I going to start developing that with him? Obviously, over time, I did some inner child work with his inner child, but we needed to orient to first the ability that adult Charlie could set boundaries, could learn boundaries, and then help younger Charlie realize that he has the ability to choose who to engage with, how to take care of himself when he needed more or less time, and how to be able to be a person separate from the people around him. Now, I'm just going to go through the 5 pillars of trauma work, what's really important for all trauma therapists, and that really impacts clients' ability to feel like, they're getting something out of the therapy. The 5 basic pillars are the foundations to trauma work. Some of it's what we just spoke about is like knowing what to focus on. The life and the skills of a trauma therapist, which I'll show you some of the back end as well for my trauma cohort that I go through with all of these trauma therapists. Essentially, the trauma training that I created is, a training program where we teach you skills, but we also help you incorporate it. There's live consultation calls twice a month for 90 minutes where we talk about learning the knowledge, incorporating it to your practice, helping you be able to work through difficult cases, knowing how to work with shame, knowing how to structure good therapy. So many of the people in the past cohort spoke about they joined my trauma training to learn about somatic methods or parts work methods. But so much more that they got out of it was like having a time where they personalize the skills for their clinical practice and that their clients are saying they feel a shift. Okay. 3rd is framing the session, a good treatment frame, knowing when you're off the frame. 4 is treatment targets. You want to come up with treatment targets that make sense. If somebody has a feeling of isolation, but you keep working on, their anger or the fact that they're drinking alcohol all the time, or, they are a workaholic, you're going to lose them, right? You got to work on the core pain point or else the client is not going to feel like you're understanding their pain point and you're not going to give them relief. So we want to help get there. And then 5 is tracking for success. One of the most important things that we want to do is help our clients know what their goals for treatment are and how to track when they're being successful or that they're making shifts. Okay, because we actually need to have successful clinical outcomes in our work. That doesn't mean that you're promising them the moon, but it does mean that you're engaging in therapy that is actually trackable and where you're making shifts. Okay, now very briefly, a lot of the questions that I got, there was a 3-question survey that I sent out for people who are in this masterclass and people who have taken it or are going to listen to the recording. And so many of the questions that I got was, how do I work with blockages? When I hear about blockages or when I hear about clients that are resistant, I think about clients that are either stuck in trauma time or are blended together. Okay. And so what happens is, and we're going to talk about like the foundation to trauma work, but essentially if I have a client who's coming in and they're resistant to change or they're engaging in certain behaviors without being able to make a shift, usually what's happening is that they are very blended with something. So I want, if you try to, you have your hands together, if any of you are listening or when you're listening, I want you to try or just watch me. If my hand is kind of clenched together and I try to pull it apart, it's going to be really, really, really hard. Right? Imagine like on the one hand, there's one hand is squeezing, right? With your right hand, I want you to imagine the right hand squeezing on really tight and the left hand trying to pull away, right? It's very hard to pull it away. This is called polarity when we talk about parts work. There's one part that's terrified. And essentially it's like, I need to hold on to this coping. I need to engage in this behavior. I need to believe that my life can't get better. I need to, whatever the need is. And there's another part that's saying, oh, we have to get better. We have to try something. This is going to be gridlock. We're not going to make a shift. Just today in our consultation group, we were talking about a client struggling with eating disorders and how there was this book that speaks about how navigating eating disorder treatment or any kind of really trauma-informed treatment or addiction treatment is less a matter of kind of pulling away, right? Telling the part that's coping to just let go of the coping and let the body just fly away or the mind fly away. There's coping, right? This resistant parts are there for a reason. What we want to do is say to the resistant part, you could still be here. You could still, obviously, if they're functioning, you could still notice your behavior, go back to that unhealthy form of coping, that relationship. But I want us to just actually get to know this part. We're not pushing you away. You're right here. Is it okay if I get to know this part a little bit? You hold on very tightly. I want to just understand you so I can appreciate your role better. What we want to do is slowly over time develop the capacity to be like, you're going for that bottle of alcohol. Could we just start noticing what are the things that you feel right before you drink? Could we look at the factors before? You're overworking, you notice that you're obsessing, notice that you're completely disconnected and you're shut down. What's one or two things that are going on internally? You want to start getting curious. So over time, you develop a little bit of a loosening of this need of this part that's coping, right? So the resistance is usually that there's a coping skill that's worked, or they don't know any other coping skill, or there's a pain that's being tended to by this behavior, okay? And so it's the same thing with self-harm, just so you know. It's like the same thing with self-harm, where in my DBT training, and I talk about this in my trauma training, is that I tell the client, if you're going to self-harm, you're going to feel a feeling of relief that none of the interventions I'm going to teach you are going to give you that same level of relief. What I could teach you over time is ways to process the distress that are going to give you relief. Maybe I'll give you 80% relief and not 90% relief, but in the long term, your life's going to get significantly better. Be able to engage in relationships. You'll be able to be present with your children, right? You'll be able to notice that you could navigate flashbacks without needing to like go to that form of coping. So you want to help get to know this part right away, okay? But that's the piece. So it's kind of this. It's almost like the same thing here. Is like if you're trying to pull at two different parts, it's very, very, if you want to pull, it's like, it's hard when we're kind of pulling in two different directions. And sometimes somatically, I'll just ask a client to try, and this is from a somatic exercise. I say, what if this is the part that's holding on really tightly? Okay. And what if we found a way to support this part, right? What if we had one hand almost provide support to the pain? What if we tried it just for a few moments? If you guys are watching or anyone watching, I see you here, Anika. I would try this, like put your hand here, right? Let's say this is the part that's trying to cope. What if we just breathe and we have me or a part of the client or just providing some support to that part and just notice what it's like for just a moment. What we want to do in therapy is that we want to soften or loosen the pull or the push or the pressure. Usually our clients come in with this pressure of they're in pain. They want to
How are you?
And what we want to help them do is to be able to find a way to look at, like, we're going to get to know this part and the pain beneath it, and we're going to find ways to support it. Okay. Now, in the last masterclass, somebody asked about this concept called phobic avoidance, where I said sometimes clients say, I don't want to help my system, or that's difficult, or I don't have loving feelings towards my inner system. Now, that's part of the work, is that then you as a therapist say, okay, it's okay if there's no part of you that actually feels like you could be compassionate. Can I just say, I'm here to help you. I'm here to help that part of you that felt all alone. And we're going to figure this out together. So there's obviously complications that come up in therapy, but a lot of the shift is, instead of jumping along that pressure or that rush, or the client saying, we need to be helped yesterday, you come in as this calm, grounding voice that's saying, I can help this part of you that has this way of coping. I want to get to know what's going on. You have to gather enough information about the client, the coping, what's working about the coping, what's not working about it. And then you're going to find a way to support it or help it process through whatever is going on internally. Okay. Now, what I want to come back to is the three foundational elements of good trauma-informed, the foundational elements of good trauma work. What you want to be knowing is, what's your why? Why are you a therapist, right? Sometimes people come into therapy world because they want to heal their own inner traumas. Sometimes it's because they're really helpful to want to be helping their clients. Sometimes it's because you have so much knowledge and you really want to help your clients heal. So you want to be clear on what your why is. And also we want to separate, like, are you over identifying with your therapist self? Sometimes as therapists, what happens is that we feel like we're blended with this savior complex that we need to help our clients. And that's usually when we feel pressure. Because when we know, okay, I'm taking care of my own self, I'm taking care of my own wounding, and also having a beautiful home life and taking care of myself, and I have a therapist part of me, and you're able to be more regulated in the part of you that is learning and is showing up in the best of your ability, you're able to settle and be present and be grounded. Then there's the how. How are you doing it? What are the skills do you have? And what are you doing? Right? Remember, that's the what kind of interventions, what's your treatment focus, and how are you going to get them to shift? Now, the rule of threes, which I think a lot of you might know from Vanderhart and Steele, is that we want to segment the work. Some of the people were asking about this specifically, about clients who feel like they're either flooded or stuck. One of the big things that clients need to know is that you're not just going to let them get flooded and that they're leaving session feeling, triggered and activated, and then they're out there all alone. But you also don't want to go too slow, where you're not getting into any of the work and not providing them relief. So the concept of the rule of threes is that in the beginning, you're helping them settle in. The second part is processing. Either this is EMDR, and even if you're not doing EMDR, it's processing some of the more emotionally complicated experiences or whatever it is that they're holding. And three is wrapping up. What you're doing is you're modeling for them the ability to be able to look at, what they actually are navigating internally, and what they're navigating internally, and also helping them know, okay, we need to take care of your system. So even though you're holding a lot, here's how we settle in. This is what we're working on today. We're processing. And then as they wrap up, and a lot of what we talk about, even in terms of helping our clients feel more successful, is connected to containment, where we also help them contain their emotions. You're going back out into your life right now. I know there's things that are difficult. What's one thing you're taking away? Or from today's session, I noticed that we're starting to realize that, the pain you have about your mother sometimes really gobbles you up. Or there's a layer of grief you walk around with. I just want to acknowledge that. Please let that part of you that walks around with that pain know you're coming back next week, Tuesday at 9 a.m. What's it like to say that? So really starting to anchor into that, into whatever it is that your client needs, but making sure that you're not just diving in prematurely or not diving in at all. And that's part of, if you have a lack of clarity, you need to get good consult or training on how am I formatting the session. You starting with, like, even in, my group consultation calls or in my training, or right now we just had our team meetings, we always start with like a 5-minute meditation. We start about a strength, a struggle, and a need. Then we dive into the work, and then we do a wrap up. So that format, for whatever way your client needs, depending on what kind of work they're doing, is very grounding and stabilizing. Now, the 3 questions your clients are asking, and you want to answer it before they ever have to ask, is, am I safe here? Right? That's trauma-informed care. Trauma-informed, it means don't do any harm. Am I safe here? Right? Are you being clear? Do you own the fact when you make mistakes or when you're not clear about something, or if they're unclear about, a miscommunication? Clarity, what are we doing and where are we going? And autonomy, does my voice matter? So are we working on my anxiety? Are we working on my relationship? How are you going to help me get there? Okay. The second piece that's important is the life and the skills of a trauma therapist. So like I was saying before, is that you're the container for your client. You are a relational template for your client. The way that all of you being here, and the people who have taken my trainings and people that I've gotten to consult with, I know that your clients feel more secure, because just like when my child gets on a school bus and I go to a gym class, or I pray, or I talk to a friend, or I giggle, or I go to therapy, and then he comes home later and I'm present and I'm there, it's none of his business what I did, but I'm taking care of myself so I can show up for him. So for therapists, it's like, it's your job to get good consult. It's your job to take care of your self-care patterns, and also to be getting good skills so you actually know how to be there for your client. And when you have that clarity, you show up with clarity, with confidence. A lot of people say, I want to be more clear about, how do I provide parts therapy work? How do I help my client understand their trauma symptoms better? Right? And when you have that clarity, the client comes in, you don't go telling them information, but you're showing up with a level of clarity, and they say, oh, but I have this symptom, or, oh, it's so weird, I'm so confused, why do I do this? And you say, oh, actually, it's called the freeze response. Okay. The freeze response is when blah, blah, blah. And it makes so much sense that this is going on. So you just normalize from a place of confidence their symptoms. Okay. And what you're doing is you're also modeling for them how to engage in therapy and in their lives, and how to understand themselves better so they don't have that level of panic or confusion about their symptoms. And then you provide the kind of therapy that gives relief. Framing sessions, I do want to talk about. The treatment frame is really important. Clients who either are not paying on time, who aren't clear about, the timing of session, who consistently reschedule, come very late, have a hard time ending session on time. These are very important sessions to name. I've had clients where people that consulted with me and they say, ask me all these deep clinical questions. And I'm like, 1 second, is your treatment frame clear? Just like people who are in undefined relationships. If you're in an undefined relationship, you're going to have a lot of anxiety or issues that you are going to get into if you don't define it. So if you define a relationship, then you say, okay, this is what I need. This is what you need. Do we agree? When you start with the client, the client says, these are my treatment goals. This is what I need help with. You say, this is the framework. These are the hours that I work. This is how much the fee is. These are my policies. If you're not clear, or if a client is violating or stepping on that, or if you're stepping on that, right, on that boundary, you're not going to have good clinical work. There was a time where I was showing up to session 5 minutes late, and one of my clients said to me, Esther, you're very, very rigid on timing. What's going on? Now, I was out of integrity because I took on too many things on my caseload. So I needed to look at what's going on, because implicitly that's conveying a level of lack of respect or a lack of safety. And so to me, it was like, what do I need to do to make sure I'm showing up 2 minutes before session on Zoom or in person 15 minutes before session, so I'm 100% there for them. If a client of mine is chronically showing up 15 minutes late, we have a conversation. What's going on here? And if they're having a hard time showing up or getting out of bed, that becomes the therapy work. But clients know, I had a client who was having a hard time ending session, and she was like, let's talk about this, that, the other. And I said, no, we're going to talk about the frame of the session. There's framing sessions and there's process sessions. We're going to talk about the treatment frame. Because what's important is we need a good treatment frame. So I'm respecting you, you're respecting me, and we're very clear about our work to make sure that we could keep doing good work together. Or else we're not actually going to be able to do the good work, right? So you're teaching them and you're honoring. It's the same thing in relationships. There needs to be integrity. There needs to be clarity. Okay. Now what's important is treatment targets that make sense. So what's really important with our clients is, what essentially they're asking is, do you see me? Do you see my life? Do you see my suffering? Do you see short and long-term suffering? A lot of times clients come in with a short-term, crises. And as we tend to the crises, I'm listening in for a theme of unconsciously, they always create chaos because that's how they feel safety, or their life is just a slew of chaos. And really there's an unprocessed wound or abandonment pain that's beneath the surface that needs some attention. And so what I need to be thinking is like, how do I offer, yes, I'm going to help them, give them relief, but also I want to help tend to the unconscious, abandonment reenactment or dynamics that keep engaging with people, where they only engage with people who are going to always abandon them, right? Or they're going to only get hired by bosses who are highly critical, so they're never good enough. And there's this unconscious reenactment where they're almost wanting to recreate a situation that they had either in a past adult relationship or with one of their parents. And I want to help tend to that core pain point. So I'm not just saying, okay, leave this job. This boss is so annoying. Oh, these relationships are not good enough. I want to look at, how do I get to the core thread of the pain point of what's really going on for them, right? So I can actually help them start making shifts internally. Now, there's clients who say, I want to do inner childhood work, but essentially they don't even have a job or they're not functioning in their day-to-day basis. For those clients, what I'm going to be looking at is, it's all very nice you have these long-term goals, but I need to help you first in the here and now to develop more safety. We need to cover your bills. We need to help you not have so much chaotic relationships. I'm going to teach you 1 or 2 basic relational skills. Okay, so you want to also be nuanced in like what needs immediate attention to have stability, and then what actually needs deeper attention, and you don't want to get distracted by the chaos that they're bringing in. The last thing that I do want to talk about, wait, hold on, I missed this one. Okay, the invisible questions your clients are thinking is, can you help me? How will you help me? And hold my hand. Sometimes clients are going through a really hard time. We're not going through a hard time, and there's ruptures and repairs, and I'll talk about this in a minute, but we're always going to have bumps along the way where we understand our clients, we don't understand, we make mistakes, we say the wrong thing. I don't mean like big ethical mistakes where you breach confidentiality and share something with someone that you're not supposed to, but we all make mistakes because we're human, and the question always is, are you there with me, right? Or a client might be having a regression, or they might have a certain struggle, and what they want to know is, are you going to be there with me in all of this? And knowing how to navigate rupture and repair and expecting it is important. For us, for our clients, what we always talk about, and with the clinicians that are practice, the first session we always say, it's not if I upset you or if I misunderstand you, it's when. There's going to be a time where you might get frustrated with me. I might not understand you. Could we talk about it right now and what we'll do in those situations? Because I want to know so I could better understand you. We don't want our clients dropping off, or like we're talking about here with outcomes and retaining clients. We want our clients to stay for the successful length of treatment. We don't want clients leaving prematurely, not just for us, but for them. If a client is coming to therapy, it takes so much energy to reach out to therapy. A lot of clients with trauma histories, the science is that they try at least 7 therapists before they find one that can actually help them. And that's really, really hard. And so what you want to do is not just start working with the client, but provide them a therapeutic relationship, good therapy, so they can actually stay engaged, so they can actually feel shifts in therapy and feel hopeful about their life and about the capacity to heal. And so one of the things we talk about here is, how do you navigate rupture and repair? They want to know that you're going to be there with them. And even if a client sometimes takes a break for some time or is upset, what you want to do is be that secure attachment figure who's here and is going to help process through whatever it is, as that wise voice. You want to be able to provide a platform of security that maybe they never had before. Okay, obviously in a therapeutic way, because that's the concept of secure attachment. Okay, so tracking success, Dr. Scott Miller does this thing. He has this research on outcomes conversations where he talks about the difference between regular therapists who have a regular professional name and clients who are doing okay, to clinicians who do incredible work. And it's not only about their level of training. Of course, having good training is important, but a lot of it is having authentic conversations and being honest with yourself and having feedback and asking for feedback. And he says, the things that you want to be thinking about as a therapist is, how do I know? The client is thinking, how do I know if I'm doing therapy right? How do I know if I'm getting better? And are you tracking this for both of us, right? That I'm actually getting the most that I can out of our work. Dr. Scott Miller says from his research, with clients who have clarity on these answers, the clients stay in therapy rather than drop out. They see outcomes improve rather having clients stay the same or get worse. And there's less complaints, and the therapist provides supporting evidence for treatment effectiveness. So clients need to know what's actually going on in therapy. Letting a client know, look, we're working on this core pain point, or this is your history, or this is what you came in with, and here's how we're doing this, and here's how I'm tracking, is very important to have that clarity. And so my life mission has been, in terms of not just treating clients, but training therapists around the world, with my book and in my trauma training, where we have a comprehensive modules on structuring good trauma treatment, being able to look at when something is not going well, or when a client is actually backsliding, or when you're not providing the kind of therapy that you want. Everything's figure outable, but you want to look at, how do you get your footing again? How do you communicate clearly with your client? And how do you start making sure that you're doing the best work? Now, there's some clients who might have to refer out. There's some clients that you need more training for, but there's also some clients that you might actually be able to do a way better job with than you're doing. And I want to help support you in doing that. A lot of group practice owners signed up for their clinicians to take this training, because one person specialized in sex therapy, and she said, a lot of people, a lot of our clients, they're not necessarily trauma clients, but they have symptoms of trauma, and I want to know how to work with them because they don't want to go to somebody else. How do I have a sensitive, trauma-informed lens? Somebody else is working with clients who have relationship dynamics that are difficult, and they're like, I want to understand the inner child dynamic that's going on. So here's a bit more about, I have a trauma therapist training that starts in June. We run it. We run our training twice. Hold on one second. We run it, twice a year, in January to June and June to January. And I'm going to show you the back end of our training, just for those of you who were asking. I want to show you some of what we go through and what is covered, and what you get out of the training. And if you are looking for a training, or if you're looking for even free resources, I encourage you to get connected to our mailing list, to really avail yourself of resources. I know for myself, I gained the most out of, hold on one second, let's see, traumatherapist.co, out of just being connected to other therapists around the world, gaining knowledge, looking at my own blind spots. We're always learning. There's always, people that we do our best work with, and there's people that we could do better work with. I think it's less a matter of being a perfect therapist. I think it's a matter of knowing who are the clients you do your best work with. How can you communicate with them? Sometimes we're treating the wrong kind of clientele, or sometimes we're working too many hours, or we're not taking care of our own selves in our lives. And so a lot of my therapy training is you getting clear on if you don't have great retention, or if you're, doing something that's not working, let's look at what we need to shift for you so you can have a sustainable practice in whatever you're working at. If it's a clinic, in your private practice, in our past trauma trainings and our current trauma training from January to June, we have a few people that have, one person just started her own private practice, actually just left her clinic job. One person actually also left her clinic job. Another person shifted her job to be more sustainable. A lot of what I look at is helping you claim your passion with trauma, working with trauma, and helping you build, sustainable work that actually is sustainable for yourself and for your clients. Because there were times that I was seeing too many clients, or I was seeing just complex trauma clients, and I needed to get clear on like, who are the clients I do my best work with, so my clients are happy and I feel like I'm in integrity with the work that I'm doing. So it's really not just about loading you up with skills, but helping you get clearer on what's sustainable for my life, what's helping me feel like I have a sense of meaning, and how can I actually do great work with the clients so they're ranting and raving about the work, and that they're referring people to me, and that in your neighborhood you're known to be the trauma-informed therapist that does great work. So just briefly, I'm going to show you just the modules because I know a few people were asking. Okay, what you get out of the training is live consultation, right? We have 90-minute live consultation groups. We have a great cohort. It's small. It's 10 to 12 people maximum. We keep it small. I get to know each of you. You get a one-on-one bonus with me. We talk about either logistics, setting up your practice, clinical consult, how to incorporate the knowledge. But then there's every other week for 90 minutes live consultation with the group. You submit your case consults. I'll show you where you submit it. I get to review it. There's a trauma resource library, answer to your hottest questions. You have access to instructional videos, tools, templates, downloads, and exercises. You have access to this for a lifetime, even beyond the 6 month of a training, because this training is a 6-month training where you get a CEU certificate, 30 CEUs. So live consultation, trauma resource library, and then access to me. I give you input and wisdom. And the big piece, which people find the most important and helpful, is community. Finding your people and healing the world together. You join an exclusive cohort of professionals committed to really a high level of clinical expertise. It's been inspiring to see the work people are doing and to see how the clinicians support each other. A lot of the people are already either trained in DBT, EMDR. This is not a training for people who are just getting into therapy. It's for people who are already therapists and have a level of self-awareness, or are coming into the field but have a lot of life and wisdom and experience, because it's a bit more advanced concepts that we teach. Just so you see what you get, here's the certificate of completion. It's approved by the state board, the Education Department State Board for Social Workers. We're getting approved by a lot of other CEU approved providers. You get 30 CEUs. And then briefly, let me just show you the module. So in module 1, we talk about outcomes, getting to the core of your client, the core thread of your client's pain point so they could actually feel relief. We want our clients to start feeling hope, like I spoke about earlier. Setting your clients and you up for success, okay? Managing your energy in the therapy room so you don't experience burnout, because if you're burnt out, you're going to leave this field, and I want you to stay in this field. I want you to manage your energy. Module 2 is having a clear treatment focus, structuring your treatment to help the clients experience relief, helping you to identify which trauma diagnosis your client has. There's different ones. Then we talk about in module 3, it's not if you hit roadblocks, it's when you hit roadblocks. So we help you confidently navigate complexities that come up in the therapy room. We want to look at when dissociation enters the room, toxic shame cycles, moving from complicated grief to processing grief, attachment interventions. Module 4 is really understanding trauma reactions and survival strategies. So I teach you all about if it's fight, flight, freeze. There's somatic interventions. I teach you how to work with the fight response, which is usually inhibited, like a push or a voice or words that are stuck in the throat. And the flight response is helping the client almost run or engage in the somatic sequencing, which is like the energy in the body to move through the body so they can actually not have that trapped energy. Because the client might be depressed because there's an inhibited fight where they never got to push someone away or actually speak up. Or somebody might have panic attacks because there's a trapped flight response. And so a lot of times it's helping the client link up their coping to what actually went on and helping them somatically move through it. And you start seeing a lessening in their symptoms. Here we help you understand neurotransmission. Module 5 is helping you with assessments. We have 20 assessments. This is what I needed like years ago. I gathered a whole, library of like different assessments, how to use them for dissociation, somatic assessments, And then there's exercises like parts mapping. I have a creative way of working with parts. I have actually a parts booklet I created, helping you educate your clients about what's an exile, what's an inner child wound, what's a manager part, how do we work when there's conflict, and how do you actually relate to parts work. A lot of people in our training have actually used some of the skills for parts work. Working with an inner child, there's boundary setting and somatic processing. And the module 6 is really helping your clients bring them to the finish line. What does success look like? How does it feel? A lot of what happens is that our clients who have gone through trauma have a negativity bias. They notice when they're struggling, but they don't notice when there's shifts. And so part of your work is to help them start noticing the small shifts. If you're not seeing shifts, then you need more training and you need good consult. But if you are seeing the shift, you want to confidently pause. Almost like Brene Brown talks about working with shame, and Janina Fisher, who's the psychologist who talks about working with shame, she has a much more of a direct way of like, almost interrupting shame cycles, interrupting clients when they're stuck in a negative feedback loop to help them start realizing the shift. So we create new neural pathways in their brain when there are small shifts, because we build small moments and small moments and small moments of more okayness and a little less triggers and a little less flashbacks to help the clients feel okay. Okay, well, we want to track the goals. You help yourself track your countertransference, and you avoid flooding and stagnation. So here is just some information. I know I'm sharing a lot of information. And I want to share one last thing with all of you, because I know a few people were asking about the back end of the trauma course, and it's easier to show it here and have people watch the recording. Okay, so the last thing I do want to show some of you, because some people say, how do you work somatically? Let's say somebody does have a certain somatic behavior that they engage in. How do I work with that? So one of the other aspects that we do when we work with attachment, just so you understand, we work with, Jack Pankseps and the neurobiology of the brain. There's exercises where we help the client understand their basic primary ways that the brain works, right? The 3 different levels of the brain. And what we do is we help them understand their basic emotional needs, right? There is play. There is, where is it? Here we go. Jack Pankseps module of the brain. Here we go. Primary processing emotions, secondary and tertiary. And we basically just help our clients understand their core affective circuits and their needs. Okay. But what do you do besides for this exercise that I teach you to do with clients, because they have on the bottom like pray, panic, fear, rage. I think there's lust. And then there's basically, if the core emotions or needs were met, you'll see empathy, trust, and pride. If they weren't met, you'll usually see shame and fear. And so there's ways to work with the primary emotions that you might see themes of. Now, the last thing I wanted to show you is, here we go. Okay. So it's not just concepts that I teach you or that people need to understand. There's also behavioral shifts. So Bonnie Bainbridge-Cohen, she's an occupational therapist. She focuses on the 5 developmental motor action movements physiologically and even behaviorally that people engage in, that they engage in as infants, and sometimes they don't successfully navigate it in their developmental of development, and you'll see someone chronically stuck in a certain behavior. So say there was play and the person never engaged in play, or say there was panic and the person never was able to feel panic and then feel regulated by co-regulation. You're going to see a client with certain behaviors that they keep interacting in. And so somatically, what I teach you is to look at, has your client not had a successful yield? The basics are essentially yield is conscious calmness, being in the body and alert. It's almost like the baby in the mom's womb, like just like knowing that they're held and they're trusted. Some clients who are constantly hypervigilant and fight or flight never had yield. And in good psychotherapy, we engage in a somatic exercise to help the client be conscious and present. And there's a yield somatic exercise they teach you. It involves touch. You have to ask consent. It's essentially helping the client feel the certain weight of the world. You can use a pillow. There's props I teach you, or help them engage in a somatic exercise where you use their arm, or helping them hold them in a certain way. And I teach you how to do it in an ethical way. So that's with the yield. Then the next one is push. If you think about the baby coming out of like the mom, so there's almost like the pushing out, wanting to come into the world. So there's clients who never learn to push, never pushing away. Then there's reach, where they're reaching for the mom. So there's somatic exercise where we work on clients who have either a hard time reaching, they always push people away, they're avoidance. So there's somatic exercises. They're very emotionally evocative. So you have to have good clinical guidance of how to use it. Going for that reach, There's grasp, and then there's pull. Now, some of our clients are chronically stuck in a grasp, where they're very clingy and needy. And what you actually want to do is work with a part of them that never got to successfully reach. And so you want to look at, is this an unmet need, like an underdeveloped need, and a somatic or physiological neurocellular pattern you want to create? Or are they heavily leaning on it and there's actually a different neurocellular pattern I want to create? So there's a lot here that we go into. I'm going to stop sharing because I don't want to overwhelm you with information. But I'm wondering, just before we wrap, if there's any specific questions that anyone has. I know I went a little overtime, and I'm going to be sharing this recording with anyone that might want it. Are there any questions about something I shared, something that you want to know about, or even a clinical case that you want to share before we hop off for the day? Hi, Anika. Ankita. Hi, Ankita. How are you?
I'm good. I'm good. I was just checking if we have any questions in the chat.
Oh,
Seemingly not. I think that's only my message and no other messages.
oh, there were a lot of messages earlier. Hold on one second. Okay, yeah, there's a lot of messages, people asking for the download. Yeah, any questions that you have before we hop off, Ankita?
So my question was just like Audrey was also talking about this, that, we keep trying to learn different modalities, and every year there's something new that's getting introduced in the market. And it's always been a dilemma that do you keep learning and learning and learning and doing every kind of practice and learning every modality, or like you were mentioning, you try to get to the deeper parts of a modality and try understand how the hell do I apply this, instead of just every year attending a new course and just knowing the theory, but you don't know how to play with that theory. So now I've reached a point, because last year I got to know 2-3 more modalities like brain spotting, then I got to know somatic work. So all these things are pretty new to India.
Mhm.
But now the dilemma is, do I want to practice all that and call myself an eclectic therapist where I know every modality, but I really don't know how to play with those modalities? Or can I just probably learn how to play with the tools that I already have in terms of CBT, DBT, and really understand my clients and what they need, because that's what's the missing part. Like you kept saying that, the parts and the pain points. I think if you can
Yeah,
figure that out, then you know what to apply. But if you
yeah,
can't figure that out,
yeah.
100 tools are useless.
I love your question. I think, to be honest, I think that first of all, most therapies are similar. Like I got trained in a DBT intensive, and parts of it resonated and other parts of it didn't. And then I got trained in EMDR. And then with EMDR, some of it was that I needed to learn the skills, but really I needed expert consultation. Like sometimes it's being connected to the right people who could support you. I think for me, I'll answer your question in a second. The reason I created this trauma training specifically was I needed a training like this 10 years ago, because I got my graduate degree. Then I did one post-grad training at Hebrew University. Then I did a different post-grad training. And I felt like I needed just a good therapeutic framework of like, what is trauma-informed care? First, help me understand trauma-informed care, right? So it was just like, I want to first just understand, like, what does it mean to have a trauma framework? So I created like all like research on like, what's the backdrop of trauma? How do we understand attachment informed? How do we use somatic interventions, right? I combined a lot of from my sensory motor training, from my somatic intervention training, from my training from Bonnie Bainbridge, who's an occupational therapist. So just like gathering knowledge and then learning, then, right, I know a lot of people can't get into parts work training. It's very expensive. And also it's like very long and robust. So I created like a parts book download. If you want it, I'm happy to give it to you, like as a resource for you to learn on your own. It's one segment of the, you know what, I'm going to share this with you, of the training, but I'm happy to kind of share it with you. I'll pull it up and I'll show it with you guys. I think to answer your question, I think the piece that is, most important is really getting good at, I think client engagement and client relationship abilities. Now I am going to tell you, do you just have training on what trauma-informed training? Oh, no, my training, just for you asked, my training is a trauma therapist training. It's really for any therapist. A lot of therapists who are not trauma trained took it just to feel more confident and to get more knowledge. I don't know if you have to call it, I call it trauma because of my advanced training, but what I would tell you is see if you could look at your clients and take one specific training that you have and really embody it and get either good consultation or and maybe learn, like I'm pulling this up right now, actually I want to pull it up, maybe take with like some colleagues, or if you're in a training, get to really incorporate the knowledge you have before jumping to something else, because I did that and it felt like it was like a lot, like I almost was like drinking too quickly and couldn't digest it all. Hold on one second, let me just pull this up. And so I think it's more a matter of like taking something and digesting it, but I think that's a little different than like sometimes, let's say you have a training in IFS and then you just realize like, you have a training in like DBT, and then you realize, wait, like my client actually needs a little bit more deeper work. And it's like, how do I actually get to do that kind of deeper work with the client, right? That DBT doesn't do. So I think it's more a matter of like deepening. Here, I'm just going to pull up the parts booklet. If somebody wants a copy of this, I'm happy to share it with you. So people get this usually for joining our trauma training, but for people who have taken the live, I'm happy to share this as like a gift. But what I teach you here is like the parts primer. And here I go through like the basics of, right, what does it mean parts? Because like with DBT, just so you know, by the way, Ankita, I got consultation from somebody named Bradford. He's a psychiatrist. He works with clients who in DBT, but it wasn't working for clients who had dissociative tendencies or had trauma. And so there's an article, I don't know if I sent it to you. If you want, send me an email and I'll send it to you, but it was like helping to understand when a client has complex dissociative parts of them, and is engaging in DBT, they're not treatment resistant. It's just that there's parts of them that need to actually be brought on board. So I think actually learning about the system is important. I think your pacing should be slow. I don't think jump at a million trainings. I think be intentional. The reason I run this is like for people who are in the training or have come to the training or are joining, I want them to be here. I'll just show you some of the images that we go through and I'm happy to send it to you. Right. So here I teach about the exile parts. And then I just teach you ways to work with it. And then there's an exercise at the end. Here's like the Hulk. This is usually like a protective part, right? But here at the end, there's like an exercise that we do to help our clients orient to their parts internally. Now you can blend DBT, right, with parts work, but I think what's really important is to be able to, Lorraine, anybody on here, I'm not going to be able to see the messages. I'm going to send you an email after this for all of you who joined. If you're on my email list, or just send me an email, go to my trauma therapist. Here, I'll post it here. Traumatherapist.co. therapist.co, or this is my email, contact@integrativepsych.co. Send me an email and I'll send you the download. But I think essentially really the answer, Ankita, is like slow and steady. Because for me, it was like, can you engage in, take the knowledge you have, get whatever information you can get out there. People who take my training before, let's say, doing like a 3-year training, because they're like, wait, I want to first have a really good trauma-informed framework, right? So I think that's really important. I think taking in too much information is almost like flooding the system. Like I had a post the other day that was like, our clients, we can't be a plate. You can't just dump information on them. We want to make them into a bowl. So first, like contain, first help regulate, take in the knowledge, right? I'll send you the recording, like take in some of this. I know I went through a lot of information, but even just like, if this training is right for you, I'm happy to share this training with you. Follow my content. I have a lot of free blogs coming out on my Instagram. I'm always putting out information that I think is very rich. So I think slow and steady, and rather be that steady base than just accumulating a lot. That's what I would say. Yeah.
Yeah, I mean, you know what? Like every time we go to a master class or we attend any lecture on any new modality, you'll always have that one patient in your mind where you're like, hey,
Yeah.
this is so apt for
Yeah.
that patient. But then it's like, tip of the iceberg that you can learn in a short course.
Yeah.
And it kind of makes me feel that, you're being unjust to the client because you don't know the modality properly. And will you end up doing more better or more harm by doing half-baked work? So somewhere it feels like, let me not delve into too many modalities. Let me just stick to what I know and try figure out how to apply that properly.
Yeah.
But like right now, when you were talking about somatic work, it felt like, yeah, you know what, maybe I'm missing parts with a lot of my DBT clients because I don't know about this. So sometimes then you again go back to being greedy that I want this knowledge because
Right.
maybe I'm missing parts in my
Right.
clients and I'm struggling and labeling it wrong, and maybe, some other
Right.
modality would work.
Right.
But
I
it
think
also
it's
made me
right.
wonder.
Right.
Sorry,
No, I will
I-
tell you something. I think the way to look at it is this, and then I gotta hop off in a minute. I think the way to look at it is like you want to apply a modality to a client, not a client to a modality. So I never take, like when I say somatic, I'm just saying, can you incorporate the body? Can you incorporate the body in the treatment? Right? So it's less a matter of like, oh, what you're doing is you're gonna plop this client and try to plop them into IFS, you're gonna plop them into somatic. I'm telling you, you're the one who needs the help, right? The people in the training, when I go to training or I go to therapy, I'm the one who's being shifted. I'm the one who's just taking in information. That's so interesting. I just learned about this concept. Let me just take this in and let me see if I can hold this information and see if I relate to my client a little differently. We don't take the information and just give it to them. You're just shifting the way you understand, you conceptualize your client, and then you're coming to them with a little bit more of a curiosity. That's always a training. I never take a, oh, I'm trying this on this client. I want you to get curious. Like from you walking away from this masterclass, I want you to look at like, am I, what is my client's presenting issue? Are they engaging in self-destructive behavior and they need DBT? Yes. Are they engaging in a self-destructive behavior, but I can help them understand what the pain is beneath why they're coping in that way? And how do I help provide some kind of relief to that pain? How do I get clearer on really getting to the core thread of the pain? Right. So really just, I think, incorporating and digesting the knowledge and really personalizing it to your practice. But I am going to say that advanced training is really important. I know for myself, like I remember, investing in trainings. I didn't have the finances. I took out like a business loan. I'm not saying anyone should do that, but I know for myself, I was going to leave the field if I didn't, get consultation and training. And then, I was responsible and I engaged in, in training, but I also invested. Some people didn't invest or chose not to. I'm saying this because some people have like the luxury of a lot of finances. I'm saying sometimes it's like investing, getting good consult. And then as I did that, I got a better clinical name and I did better clinical work. So I think just knowing like when we invest, we get a return on our investment. I know for myself with the trauma cohort, we track our clients, the people in the training's goals. Are you getting what you need out of this? Like I'm very protective over that. And it's a parallel process too. And I listen to feedback. You need more of this, less of this. And it's the same thing for clients, like check in with your clients. If something is not landing, great, allow them to share with you. So you're also incorporating, their feedback. So it's this parallel process. Like I'm teaching, people in the cohort are only the ones who are getting a lot, making a shift. I'm seeing them grow because I'm protective over that. And then they're also feeling the same with our clients and their clients are happier. Their clients are good fits for them, so they're all growing and we're all like aligning more because it's knowledge and it's in practice. But I have to hop off because I have another meeting. Thank you guys all so much. I'm going to send the recording. I put my email here if you want the download. Thank you all so much for being here. I appreciate you all and your desire and commitment to growth. Bye. Take care.